Last week on Reel to Reel, in the first of a two-part series, reporter Julie Bollier told us of the growing opioid epidemic and how it is affecting Western Massachusetts. In part two of her series today, Julie addresses awareness and prevention. Also, what our Catholic schools are doing to warn students of the dangers of drug use.
Opioid addiction is now an epidemic in the U.S. and Western Massachusetts. It is now the single leading cause of accidental deaths in our state and continues to grow rapidly. Jim Greer is a substance abuse educator at the Western Mass Women's Correctional Center in Chicopee. He works with women who suffer from addiction and sees the problem firsthand.
The heroin epidemic has been something that people have been, it's gone into every neighborhood. It has no respect. So it's easy to get, it's easy to acquire heroin, and it seems to be somewhat easy to acquire opioids when you go to the doctor. There's no quality control over the manufacture of heroin, so you don't really know what's in it. So there's no way to guarantee the safety of the person that's going to use it.
Dr. Robert Roos at Providence Behavioral Health Hospital agrees that opioid addiction is a disease which can affect anyone at any age.
I've seen patients along the entire age spectrum. I've seen individuals develop addictions as children and adolescents, and I've treated patients in their 80s with opiate addiction, starting after prescribed opiates for a hip replacement that happened in their 60s or 70s.
What are signs that a loved one should look for? Noticeable elation or euphoria, marked sedation and drowsiness, confusion, constricted pupils, slowed breathing, intermittent nodding off or loss of consciousness, and constipation. Doctor shopping, which now is not an option in Massachusetts under the new opioid law, shifting or dramatically changing moods, extra pill bottles turning up in the trash, social withdrawal and isolation, and sudden financial problems. This local parent saw the signs and hit a brick wall when she sought help for her son.
I did take him to his pediatrician. We had tried so hard to get him some help. And the response I had from one particular pediatrician was pretty much he minimized my concerns and said, "Oh, we've all done pot." And that was not my value. It wasn't what I was coming to a professional for. I was expecting backup and help, and I don't feel as though I got that. It's up to a parent to advocate for their child, and you can only do so much, and you have to depend on the professionals in the school system to join you on that walk.
For this parent, help came too late. After several years, Sean was diagnosed with ADHD and depression. He was already an addict. In 2009, he attempted suicide by hanging and suffered a permanent brain injury and permanent paralysis. How can we better educate our children and prevent drug use altogether? Most schools in Massachusetts still use the DARE program, Drug and Alcohol Resistance Education. Some say it's working, while others do not. Sean went through the DARE program in public school.
I think it made him aware of substances, and I don't know if it stopped him from using anything, to be honest.
Programs like DARE received a lot of attention through the 90s, and they were popularized by a lot of media campaigns and some very catchy, quippy slogans. They did not generate the response in terms of prevention that I think the public health community was really looking for. On a whole, when looking at the science, the public health community has declared them not to be effective. We can provide teenagers with different opportunities to do sober activities, understand how to resist peer pressure, cope with stressors like family challenges, school challenges in healthier and productive ways, and really give a lot of education around the risks of using drugs. That's what's shown to be more successful.
So far, these young parishioners at Sacred Heart in Feeding Hills have gotten something out of DARE and their parish program.
We learned about marijuana and how it can really hurt you. And we've also learned about tobacco and chewing tobacco.
I agree with Cindy because these drugs involve a chemical that makes it addicting, and people think that, oh, I'll just try this once and I won't get addicted, when they will, and they don't even realize it.
Mm-hmm.
Students in Catholic schools are not immune from the current crisis, so educators have come up with additional approaches.
Within our elementary schools, first of all, we focus on the child's development of a very healthy self-esteem and wise decisions. And we do have drug programs mainly introduced in grades 5 through the high school level. In some of our schools, we have had other intervention programs. So again, we're basing this on how can we make the wise decisions.
There's many people that have thought this could never happen to them or never happen to their child or their family. And what we know now is that it can impact and it can affect anyone.
It can happen to anybody. You know, my son came from a family, 2 parents loved him. He never wanted for anything. He had every opportunity, involved in sports, CCD, church all the time. You wouldn't think that this would happen.
Talking to your kids about drugs isn't easy. First, start when your child is in middle school. Be prepared to answer questions about your own smoking and drinking. Know the facts before you get started. For example, marijuana was just legalized in Massachusetts for purchase to those 21 and over, and an opioid prescribing law went into effect last year. Make family rules and keep them. Ask your child what's going on in his or her life. Keep your home safe from alcohol, tobacco, and other drugs. Lock up all prescription drugs and alcohol at all times. Don't let your child or loved one become another statistic. I'm Julie Bollier, reporting for Real to Real.
For more information on the opioid crisis in Massachusetts, you can find a link on our website at iobserve.org. Also, to learn about inpatient as well as outpatient services and availability at Providence Behavioral Health Hospital, dial 413-539-2973.